Henry, before all this, I used to be seriously addicted to soap, but fortunately, I'm all clean now. Yeah, true story. Oh, sorry about that. Nice to see you. My name is Ollie, or Oliver. Welcome to our clinic. I'll be your physiotherapist for today. I see you've already filled out your little intake form here. From what I gather, you're here for a knee examination. Is that right? Okay. I see. Well, you've definitely come to the right place. Go ahead and have a seat. I'll just confirm a few details while you're getting settled in there. Your date of birth for me, please. Okay. It's coming up soon. Happy birthday in advance. And, of course, your full name for me, please. Just spell that one out. Okay. Just confirming this is how you spell that. Is that the right spelling for your name? Okay. Always good to double check. And like you said, you've been experiencing some knee pain in your right side. Can you tell me a bit more about that? What brought this on? Okay. Gotcha. Alright, so you were running quite quickly and suddenly felt some pain in the back of your knee, or just above your knee. Okay. More in the thigh, back of the thigh. Okay. I see. And when did this happen? Yesterday. And just out of curiosity, has this been the first run in quite a long time, or are you a regular? Okay. So you've run a lot in the past, had a hiatus for a few months, and this was your first run in a long time. I see. Okay. No, I appreciate you telling me. It's all helps build a picture of which structures and which areas could be affected. It's all relevant. Speaking of relevance, your levels of pain that you're experiencing, if you had to rate your pain from 0 all the way to 10, how would you rate your pain just right now in the knee as you're resting, as you're sitting? Okay. Yeah, I know it's not a perfect question, but just answering it as best you can. Okay. Very minimal, like would you say a 1 or 0 out of 10? Good. And what about when you're doing weight-bearing activity? For example, maybe you tried to run again after that pain, or maybe today when you have been walking around. Okay. So it's been quite sore putting weight through it. Yeah. Roughly a 6 or 7 out of 10. Okay. Does that quickly settle back to that 0 or 1 once you've taken a break or sat down perhaps? Okay. I see. I'll just make a note of that. We call this your visual analog scale or pain scale. It just gives us an idea of the severity of things. And of course, pain is very unique and unique to the individual. Okay. Alright, what I'll propose today is we'll go through a observation of your knee joint and surrounding tissues, like your ligaments, menisci, and the joint itself, of course the surrounding musculature. I would also love to check to make sure that there isn't any excessive swelling or bruising, anything that might indicate maybe an X-ray required or MRI. But I've got a rough idea of what you might be dealing with currently, but it's always good to go through some safety checks just to be more confident with our clinical diagnosis and accuracy. So let's start with a quick feel of your knee. I see you've got some long pants on. I know it's quite cold at the moment, but are those able to be rolled up just to above the knee there? Yeah, that's perfect. Yes, as high as you can get them without cutting off circulation, of course, but that's actually perfect. Yeah. Okay, and we'll just do the other side as well, just so I can compare left and right sides. Yeah. Okay. Comfortable there? Alright. What I'll do, just having a quick feel in that knee area, just a bit of a sweeping motion along the top of your thigh region. Just checking for any excessive swelling that may be present around the knee or pooling around the knee joint. Just comparing that to your other side or your unaffected limb. I see. So it seems like there's a little bit of swelling, pooling. You can see as I pull that one, there's a bit of that. Yeah, you can sort of see that extra swelling there, fluid. Also feels a bit warm to touch. Not quite like a fever, but still a little bit of warmth there compared to your other side. What I might do is go through a quick measurement or circumference of your knee. Sit tight. So just with our little measuring tape here. Yeah, just have your leg out straight for me. That's good. Just get that one wrapped around there. Okay, and just getting that one. Alright, 43 centimeters. Okay, just one more time, wrapping this one around the center of your knee. Okay, yeah, 43 centimeters. Okay, and then just your other side. And just confirming no issues or discomfort in your left knee. Okay, that's good. Just measuring the circumference of your unaffected limb for comparison's sake. Yeah. Let's see, that one comes to slightly less. Yeah, about 41 and a half. Let's try again. Measure that one again. 41, yeah. Okay, so 41 and a half versus 43 centimeters. So there's a little bit of that extra circumference and fluid pooling in there. But let's have a look now at some of your movements. So, I'm not sure if you've seen these before, but this is essentially the physio equivalent of a Taylor's measuring tape. This is a goniometer. Goniometer essentially can measure the amount of movement, range of movement at a joint. And in this case, we'll use it to measure the degrees of movement for your knee. You can see it's got the sort of 180, 170, 160, 150, all those units and degrees there to help us accurately measure active movement. So for your knee, I'll get you to, sitting on the edge of the bed, straighten your knee for me as best you can. That's it. I'll just place this on your knee joint. And okay. That's quite good actually. So we're getting 180 degrees of movement there, which is a nice straight knee. This is good. That is normal. Yeah. So that's a good sign. What about the opposite way? Our knee only moves forward and backwards, or flexion, extension. So just bending your knee now for me as best you can. Okay. That's it. And is that as far as we can go? Roughly there. Okay. Just try that one more time for me. Yeah, okay. And did that cause any discomfort or maybe a bit of tightness, soreness? Yeah. Okay, so that reproduced a bit of your symptoms, you would say. I see. Okay. Well, what we might do now is just quickly feel your kneecap area or your patella, that little circular bony structure that sits on the front of your knee. So just getting in there and giving that one a wriggle. Side to side, lateral, up and down. It's looking good, quite mobile. And just applying some pressure this way and some pressure laterally. Okay, good. One more time. No discomfort as I move your kneecap, I hope. Okay. All of those seem to be moving quite normally, which is good to see. Again, just a little bit of that, maybe slight resistance with the swelling being present, but that's okay. We would expect that after something like this. But what I'd like to check next is your kneecap reflexes or tendon reflexes. I have with me here a little tendon hammer. So just a little rubbery bit on the end here. Little rubbery bit. And we'll just be gently tapping. Tap, 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 tap on your kneecap tendon just below your kneecap. Yeah. So what I need you to do, just sitting, relaxing your knee on the edge of the bed for me. And I'm just going to gently tap that one. There we are. Okay, that's looking like a normal response. Normally it'll kick out like so in response to that tendon being tapped on. That's normal. Yeah. You can also do it on your elbow for your tricep muscle, as well as other areas like your Achilles tendon. Yeah. But that's looking fine. So that's important for some neurological testing, but no troubles there. Speaking of neurological testing, I just want to test your sensation or how your body perceives input or stimulus. So just on the other end of our tendon hammer, just a nice little, not sharp, but slightly pointed tip. What we'll do, just like a pencil, just going to try and draw around those knee structures on the outside, on the inside, like so. But we're also going to compare it with soft touch of a cotton ball. So soft touch versus sharp touch. Soft versus sharp. Soft versus sharp. Sharp versus soft. So just closing your eyes for me, or just let me know which stimulus you can feel, either soft or sharp. Okay. Closing your eyes for me, no peeking, and good. Good, sharp, yes. How about this? Good. And again. Correct. Now just behind the knee. Good, sharp. Good, sharp again. Yeah, sharp again. Outside of the knee. Good, soft, soft, sharp, soft, soft. And lastly, just on the front of the knee there. Sharp, sharp, soft, sharp, and soft. Very good. I feel like waving a magic wand doing those tests. Avada Kedavra. Just kidding. But that's good. You are able to differentiate the soft and sharp touch. Again, those neurological tests are all okay. Always good to hear and see. Just checking now. Just checking your strength. So, as you can imagine, running injuries, there are a lot of muscles involved, namely our quads on the front of your thigh, but also your hamstrings in the back thigh region. So I'll just have a quick check of those muscles, and they're responsible for both straightening or extending your leg, the quadriceps in this instance, and bending your knee like you did earlier, which was a little bit sore, which is that hamstrings responsibility. So what I need you to do is to straighten your knee, straightening like so, against my pressure. I want you to push through my pressure as hard as you can, okay? Just as long as it's comfortable for you. Yeah. Try to push through me, through your tolerable range. Okay. Makes sense. All right. Yeah, just have my hand there and kick through me. That's it. Okay, relaxing. One more time. Kick. Good. All right. And just one more time for me. Kick. Good. All right, just relaxing that one. Compare that with your other side now. So, same thing, kicking that one out. All right. On my count, 1, 2, 3, go. Kick. Good. And again, kick. Good. And lastly, one more time, go. Kick. Excellent. Okay, resting there. And did that bring on any of your symptoms? No discomfort? Okay, that's good. Maybe a little bit. Yeah, minimal. Okay, I see. Well, good thing is both your knees seem to have quite equal strength, left compared to right, in those quadriceps muscles. So that's good. Let's try the hamstrings now. I think this will be a bit more interesting. So let's do your affected side first, that right side. So bending that knee against my resistance now, okay? That's it. Through me as best you can. Okay. And relaxing. Good. Yeah, a bit of pain there. Bit of discomfort. Okay. Let's try it one more time. I know it might seem cruel, but I really just want to try this and really feel the strength, okay? Feel the muscles working. Let's try it one more time and pull back. Good. Good. Keep going as much as you can tolerate. Almost there. And relaxing there. Okay. Good. Just on the other side now. Let's give that a go. So, bending that knee for me. 1, 2, 3, go. Bend, 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 bend that knee. And relaxing. One more time for me. Bending that knee. Bend, 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 bend. Yep. Very good. And relaxing there. Okay, that was a bit more telling. Your sore side seemed to not only be more painful, but slightly weaker than your unaffected side. Again, that can just be because of pain. It's natural to not push as much because pain is present, but it is still telling. So I think I've got a pretty good idea of what's going on and which structures might be affected, but I did just want to rule out some other structures. You may have heard of them, some of your ligaments. Athletes such as yourself injure them all the time, like your ACL or PCL, MCL, as well as LCL, are all terms you may have come across or heard before. But we're actually going to do a few special tests to check on them now, to see if they are involved in any shape or form with this current injury you've got. So our first one will be testing for the ligaments on the insides and outsides of your knee joint. Your MCL is on the inside and your LCL, or lateral collateral ligament, is on the outside. MCL standing for medial collateral ligament. Okay, so just applying some force inwards now on that knee. That's it, just some compression in. Okay, any discomfort as I apply that pressure? No, it's good. And I'm going to do the opposite now. Pressure going outwards. Okay, and out, 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 out. Any discomfort or pain in the outside of the knee joint there? No. Okay, well, that's good to hear. We'd call those a negative test, which is a good thing. It means it's likely not involved any of those structures. So let's check the ACL now with a little test we call the Lockman's test. So just going to be applying some pressure. Yeah, I just need you to bend. Yeah, lying down, bending that knee slightly for me. Just let it sit there. That's it, nice and comfortable. And I'm just going to be applying some force forwards, through that knee. Okay, and then also towards me as well. So away from you and then towards me. Just to test those ACL and PCL structures, or anterior cruciate ligament and posterior cruciate ligament. Okay, so just applying that force forwards now. forwards and back, forwards and back, forwards, back, forwards, back, forwards, back, forwards, forwards, back, forwards, back. All right. Have a break there. So that's good. Both of those ligaments are doing their job. They are most definitely intact. If there was any sort of laxity there or excessive movement, then that would be quite a strong indicator that one or two of those structures are affected, being the ACL and PCL. But fortunately, all of those ligaments seem to be unaffected, which brings me to the conclusion that I think you're dealing with a hamstring strain, or hamstring muscle strain. The fact that you got it after a period of long breaks from exercise, when suddenly starting back up again, as well as the fact that it was a rapid sprint or acceleration, deceleration type of activity or mechanism of injury, that would be quite a big indicator that it's to do with those hamstring muscles, especially if you are getting pain when bending that knee from earlier, those little muscle checks we did. A little bit of swelling there to suggest that it might only be a mild strain. No excessive swelling, a little bit, but not excessive. And you still have very functional movement within your joint. So these are all good signs. Unfortunate that we had this injury to begin with, but positive in the sense that this kind of injury has quite a good prognosis and can heal relatively quickly. You'll be back running in no time. So what I would recommend here is a few things. Firstly, I'm going to apply a bit of gentle soft tissue therapy or a bit of hands-on massage just to help with that initial healing process, get things feeling a little bit more calm and getting that circulation flowing to those structures, and that will promote healing. That nutrients from the blood is amazing, as well as give you a bit of pain relief, providing different type of stimulus to the brain. It's like a distraction, essentially. But I'll just get my hands clean, and then we'll go ahead and work on your knee. All right. Now, I've just got a bit of this physio cream, as we call it. Just applying that one, warm up those tissues there. That's it. Just applying that one essentially all around the knee joint, on the quads, the hammies. Have you got much planned for the rest of the week? Are you taking it easy, I hope? It's good. Seeing some friends, catching up with family. Yeah. It's good. Really good. Yeah, personally, I've been doing the same lately. A lot of my friends have little kids, 1-year-olds, 4-month-olds, and it's been really nice to spend time with them and see them grow as parents and also their child as well. It's very cute. It's just awesome to be an outsider looking in and seeing that growth, not only in the child but in the parents too, maturity, and that level of care. So it's been really nice to be a part of that with my friends lately. Yeah, I'm glad you've been keeping busy. That is good to hear. Hopefully you're able to rest over the next few days. I'm really glad we were able to book you in at such short notice for injuries such as this one. It can be very good to be seen sooner rather than later. Worked out quite well as I had a cancellation for my last slot of the day. But in any case, I hope you are able to rest for the next few days. Let your body recover. We don't want to overload those tissues too much too soon. Just some gentle, active recovery, like brisk walking, cycling, or perhaps some swimming or pool-based activity can feel quite relaxing and therapeutic, much like some hands-on massage. There we go. That should help those muscles calm down and reset. Go ahead and move that knee for me, just bending and straightening gently. How does that feel? Good. Maybe a little looser, less stiff. Very good. I'm glad. Now, the other thing I think you would benefit from is some taping, Kinesiology or K-tape. I have with me some here. This is complimentary, of course, all part of your physio session today. But I'll just get a towel and wipe off that cream from the massage, as the tape here doesn't adhere very well to slippery or oily surfaces on the skin. So let's get that towel, just wiping that one off. There we are. Good. There we are, nearly done. Okay, that's better. The tape will definitely stick much better now. So this is K-tape. Essentially, it will sit on your muscle, the belly of your muscle, in this case your hamstring, and can just provide a bit of a nice, distracting sensation and stimulus for the body, and in essence some pain relief. Okay, we'll get some of this on you now. All you need to do is sit there and relax. Here we are. Our rock tape scissors. Rock tape's the brand we use here. But just cut that one up. Give me 2 seconds. Okay. Now this piece is a little bit big. It's more for maybe a lower back or lumbar pain. So, funnily enough, we can fold it and cut this one in half. That should be just enough to cover your sore area in that hamstring muscle. There we are. So, these 2 pieces will just go over your hamstring belly, muscle belly. However, I want you to take this on board as well, because you can definitely do this on yourself, or have a friend or family member do it for you. So we'll just trim the edges of these K-tape strips, just like so. Doesn't have to be perfect, but just avoiding a sharp edge, like so. There we are. 2 more to go. Rounding out that edge, just so it sticks to the skin a bit easier and won't lift off. There we go. Right. Now, we're left with something like this. So, this first one we're going to apply by making a rip in the middle of the tape, pulling this to expose the middle, like so, and you can see that there is the ability to stretch and also to have it on slack. So stretch, slack, stretch, slack, tension, no tension. This is just going to go about 50% on that area there, just on your hamstring. Good, 50% tension. Going to apply the remainder with no tension, just like so. The remainder with no tension, just like so. Here's our first piece. And our second piece, same thing, ripping the middle. That's it. Pulling that apart, applying that 50% tension. There we are. And letting the ends go slack. Let the ends go slack. Good. How does that feel? Good. It does feel quite nice. Now that we have those tape on, I would like to talk quickly about management. Something we call PEACE, an acronym, P-E-A-C-E, PEACE. P stands for protection. I want you to, for the next few days, minimize any aggravating activity. I also want you to elevate your knee, particularly when you are lying down or sleeping at night, perhaps with a nice comfortable pillow or cushion. A is to avoid or limit the amount of anti-inflammatories you may be taking. There is some evidence to suggest that it can hinder and slow tissue healing, as inflammation is a integral part of healing process. It's up to you, but just something to consider. And C stands for compression, which can help alleviate some painful symptoms and promote blood flow to the area. So consider a knee brace, which you can purchase from the front, as well as using the taping technique we just went over. There's plenty of tutorials on YouTube as well if you ever get stuck. But lastly, E is education, and you're already taking that on board, but just following those above steps, not doing anything too exhausting, too explosive or intense. We want to encourage active recovery rather than passive rest, but while being reasonable, of course. Please listen to your body. That should do us for today's physio assessment, but there are many things we could discuss further, particularly when you have healed a bit more. I'd love to go through some exercises to help bolster the strength in your knee and get you back to doing what you love, in this case, running. Perhaps if you book in for next week, we can, look into that. Okay. Well, please chat to Linda at the front, and I'll be sure to email you with all of those tidbits and points of information, just so you don't have to remember them all. Once our practice management software comes back online, I swear every few days it goes down, but what can you do? We roll with the punches here. Then I'll send that through to your contact details. We have your email on file already, so expect that one in the coming day or two. Thanks for your patience, and glad we could see you at such short notice. You take care, look after yourself, have a wonderful rest of your week. Bye for now. Thank you to my awesome patrons, Andres Orlan Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore,